first time I met Kevin Sexton on the search committee, I met a man who knew the needs of this community intimately, who was deeply committed to access, who did not take himself too seriously, and whose personality and intelligence I knew would embrace and expand the legacy of Holy Cross.
In 1999, Montgomery County approached Holy Cross Hospital about being a partner in the Maternity Partnership Program. Kevin hadn't been our president for that long, but he answered with a resounding, "Yes, we will do it." This program was to provide prenatal care for women who might not otherwise be able to access services in Montgomery County. Not only were we the leader and the only partner in the Maternity Partnership, but under Kevin's leadership, we increased the number of deliveries at Holy Cross Hospital. We provided private rooms for all of the women that deliver here, and we demonstrated that for a segment of the population that might not be able to access care, we had excellent outcomes for mothers and babies. That is a testimony to Kevin's can-do spirit. We did it.
Kevin J. Sexton built upon his early commitment to prenatal and primary care access with parallel commitments to expanded access to hospital services and improvements in the quality of care.
Back around 2004, the emergency department was seeing more and more patients coming to seek care in our hospital. We recognized while a lot of these patients had true emergent needs, there were far too many patients who were coming to us because they lacked primary care. They didn't have a physician to see, and many of these were uninsured patients. Under the leadership of Kevin J. Sexton, we not only expanded the size of our emergency department, nearly doubling the size, more importantly, we started looking to other ways to provide primary care for these patients, especially the underserved and those without any insurance.
Kevin Sexton looked at the environment and said that we needed to provide access to care. And as part of that, he decided that we should open health centers to provide care for uninsured patients. This is a revolutionary concept. Hospitals providing care, a community hospital providing care to the uninsured.
During my first Joint Commission preparation, I invited Kevin to come for the leadership interview preparation, and he came, as I knew he would. I hated to waste his time, but he was great. And then when we actually got to the real interview, he was a master. He just walked in there, he knew all the data, he knows all the people, he knows all the processes of what goes on here, and he just wowed them.
He brought together the experts, he gave us the opportunity, he gave us the time, and he allowed us to form the first seniors emergency department in the country. Ever since then, he's been a man of his word and supported his commitment to allowing us to give better care to our seniors in the emergency department.
The pursuit in establishing Holy Cross Germantown Hospital required a masterful strategy because it was a complex and contested project. There was the Certificate of Need process, which is very prescribed and rigorous, but there were other competing influences that were important to the end result, and those were the community and political and zoning processes.
Hearing examiner has recommended the CON go to Holy Cross.
This is significant because it's the first hospital located on a community college campus anywhere in America. Just think of the implications of that in terms of serving the healthcare needs, not only of the up-county residents and people that work in that area, but the entire region. And this will go on for decades.
Kevin not only pursued the necessary approvals for the first new hospital in Montgomery County in 35 years, but at the same time, he pursued approvals of a major expansion at Holy Cross Hospital, a bold, strategic, and visionary move. In recognition of his accomplishments in transforming Holy Cross Health to a broadly based delivery system of 2 hospitals, 4 health centers, and 2 centers for obstetrics and gynecology, and in recognition of his outstanding service to the community, the Holy Cross Health Board of Directors named the Kevin J. Sexton Campus of Holy Cross Health, the Kevin J. Sexton Lobby of Holy Cross Germantown Hospital, and established the Kevin J. Sexton Fund to increase access and improve community health. Throughout the years, Kevin demonstrated that he cared deeply about all staff, including the community-based medical staff.
And it started when he came 18 years ago, and he actively sought out members of the medical staff. He had meetings with them, including me and many individuals and many groups of physicians. And from that moment on, he set a tone that he was willing to listen, understand, and clearly demonstrated from the beginning that he felt the physician medical staff of this hospital would be a big part and a major leg in his development of a strategy that would eventually lead to the successful institution it is today.
Mr. Sexton has a close relationship with nursing staff. He respects the frontline nurses. He walks by the hallway of the nursing units. He makes it a point to stop by and chat with the nurses and thank them for what they do every day.
Kevin's career has been synonymous with success, and it's because he is a principled leader.
He sees many things about the needs of the community. He just looks beyond what the obvious is, and he looks long term.
His honesty and his commitment and dedication to the most vulnerable people in our community.
Because it didn't matter, particularly for our maternity partnership patients, whether you were the wife of the gentleman that cleaned our floors or the wife of a bank president. It was Kevin's commitment to that same standard of excellence for everybody. And that is something that I just admire and respect about him.
When I think of Kevin, I think of somebody that I can trust to do the right thing.
He's a man of integrity, cares about his employees. And it was great to hear that that's a national reputation that Kevin has brought to Holy Cross. There isn't anybody here who doesn't see the significance of a $14 an hour minimum wage.
Every holiday when he comes, he always come and see us how we doing in the cafeteria. He greet everybody. You know, he left his family and then has to come and see us how we doing, how's everybody's doing, how's everything. It makes me so happy, you know. Who does that? He is the best person. I'm gonna miss him so much.
Thanks, Mr. Sexton, for making this a great place to work.
Thank you, Mr. Sexton.
Your leadership has set an example for all of us. Thank you.
Kevin, thank you so much for all you've done for this hospital. We're going to miss you here.
Thank you, Mr. Sexton.
You've been a great leader, Mr. Sexton.
Thank you for everything you've done.
Thank you, Mr. Sexton.
Thank you, Mr. Sexton.
You made this a great place to volunteer.
Thank you, Mrs. Sexton, for your leadership.
Thank you, Mr. Sexton, for the large positive change you got in this hospital.
Thank you, Mr. Sexton.
You made this a really great place to work. Thank you so much, Mr. Sexton.
Thank you, Mr. Sexton. And thank you for all the years of caring for us.